Hi there, my name's Lara, Calder, and I work in the south of Glasgow in health improvement, and I'm here today to talk about Three Hills Community Garden, which was developed over a number of years. The picture you see there before you is actually on the tool shed in the garden and is, I think, a lovely mural. Why was Three Hills set up? Well, Three Hills was actually part of a large project which quite a few people probably know about, Healthy Weight Communities. The garden was created as one element of the communities of Preston and Glasgow being selected as one of 8 national Pathfinder pilot sites. And the objectives of Healthy Weight Communities was to demonstrate the ways in which a concerted and integrated community-wide approaches to engaging children and families in healthy eating, physical activity and healthy weight activities could have a greater impact on long-term health outcomes than current discrete activities. So a garden lent itself well to those objectives, but Healthy Weight Communities was about communities, and it was about what the local community wanted. And as a result, we held a number of consultations with people living in Preston and Glasgow to ask them what they wanted. And the thing that came up very, very strongly was, we would like a community garden. So we were there set for the challenge and we went about developing it over, as I said, a number of years. Why was Preston and Glasgow selected as a Healthy Weight Community Pathfinder? For very obvious reasons. It had very high levels of multiple deprivation and health need. There was already some community work going on in the area with some active community involvement. There was some connected existing work. We had Live Active and Shape Up, Keep Well, Child Smile, Health Promoting Schools and Health Programme. At the time we had Cell 36 funding because we're going back to 2008-2009. We had alcohol prevention programme in the area and Paths to Health and Get Cooking, Get Shopping. But the other crucial thing about Glasgow and Priest Hill, because other areas in the south of Glasgow were considered, like Ibrox for example, was that it had quite a bit of outdoor recreational green space that wasn't being used. This is just, you're not going to be able to see this, it's really showing the deprivation picture of Priest Hill and Glasgow, and as a generalised rule you would prefer to have most of the lines on the left hand side and not the right hand side, because it's really showing that this area has a far higher than the Scottish average of numbers of smokers, alcohol related deaths, worklessness, income deprivation, serious violent crime. It has, for child health, far lower breastfeeding rates and far higher dental hospital admissions. This area has a very low BME community, unlike other parts of south of Glasgow. And this is just again showing the community health profiles, and you can't see it, but the blue line is the Scottish average, the dark blue line, and the red line is the Priest Hill and Glasgow. And what it's really indicating is the average life expectancy for a man there is about 68. But 11% of babies are breastfed in this area, and about a third of the population are unemployed. So, on to the garden. The garden, as I said, took quite a number of years to establish, and we had quite a number of obstacles in our way, I have to say, and the biggest one was actually being able to get some land. We thought this was a really green area, a good reason for putting Priest Hill and Glasgow forward for Healthy Weight Communities when we bidded for the monies. But the reality was, although it had a lot of green space, derelict space, it actually was all stalled spaces and we couldn't actually access it. And this, I think, I have to say, led to quite a delay and expectations of the community feeling that we're being let down. We tried to get land in Glenlora Drive, but it was scheduled to become a housing development. We tried to get land next to a primary school, but unfortunately it was a stalled space. And this is going back a few years ago. I think things have improved. And ultimately, we managed to secure land within the grounds of the new build primary school, Cleves Primary. Three Hills, though, is not just a school garden, it's a community garden, and it's a garden for the people of Priest Hill and Houselwood. And the initiative has several aspects which I think are common to a lot of gardens, but they're combined together, and that makes it a little bit more unusual. Growing your own, it provides opportunities with individual beds. We also have group beds. Deafblind Scotland have got a bed, Pollock Carers have got a bed, and a number of other organisations. It's also got a demonstration teaching bed, and basically this is to help local people take small steps towards healthy behaviour changes, increasing their physical activity and healthy eating. It's located within a school, as I said, and it has two parts to it. It has the community growing area, but it also has two natural outdoor play facilities, one for the children of Burnbay Nursery, and one for the children of Cleves Primary. So the natural play areas for the children, you will see later some nice pictures, are like storytelling with the Gruffalo, and for the older children, the primary children, we've got tunnels, and we've got a tree house to climb, and it's fun. And for the adults, we have a polytunnel, a tool shed, we have a teaching space, and obviously quite a few raised beds and an orchard, etc. Being located within a school and being a community garden for all age groups and open to all in the area with almost, I say 24-hour access. The gardens are opened at 8 o'clock in the morning and close about 10 o'clock at night. Provides an opportunity for lifelong intergenerational learning. The teaching staff within the nursery and the primary school have been fantastic in bringing the children out to have lessons in the garden as a green classroom, and the community gardener and members of the local community gardening club have been so helpful in teaching and helping the children learn how to grow things. We've also provided horticultural workshops for adults in the area and cookery demonstrations with homegrown produce. We're now in the winter time, so we're focusing more on some indoor work with cookery demonstrations. Therapeutic environment to provide green prescriptions is the last aspect that the initiative brings, and through NHS referrals it incorporates both social and quiet spaces with elevated raised beds and flat areas for wheelchair users. So we've got some nice quiet spaces if people want to just go away and contemplate, and we've also got some raised beds which we have a wheelchair user who has one of the plots, and that's been helpful. We've been working over the last couple of months with the NHS referrals, and at the moment we're developing a referral pathway for people with mental health problems, and are working in partnership with Platform. Referrals are coming in from the Stress Centre through Lifelink, and we have been working with colleagues in the mental health primary care teams as well. This is a picture, and I think this really does tell the story much more about the garden. This is the Kids Gardening Club, which ran on Saturday mornings during the school holidays, and the evening workshops were running during the summer months in the evening, funnily enough, on Wednesdays. And this is a picture of Chris, our horticulturist, and some of the children, and some of the evening workshops. This has been a community teamwork project, and we had a community orchard planting event a few months back now, where members of the community got together and started planting some trees, and we've now got about 30 apple trees on the banks of the school grounds. And this is a picture of the nursery children in Burnbrae who have been equipped with waterproofs and are out playing in the mud kitchen, which, as you can see by their delight, they are enjoying. No project could work unless you worked in partnership, and Three Hills is a really good example of partnership working. Three Hills has a garden and steering group and committee which is made up of local people. They oversee the day-to-day management of the garden, and at the moment are looking at its sustainability and future funding. Glasgow City Council, well, we in Health Improvement could not have done this without our colleagues in the council. The Green Space team designed the garden, and they basically project managed the whole development of the garden. And James McMacken, the Green Space officer, still oversees the garden to help and support. As part of the project, we built in some funding for community horticulturists, and this is because whilst this area has some green space and some of the houses within the area have gardens, there's not a large history of people being able to garden. So we've employed Chris, our community horticulturist, on a part-time basis, and she helps to support the gardening steering group, and also she helps support with delivering workshops and just generally keeping the garden neat and tidy. Ourselves in Health Improvement have been involved with the whole of Healthy Weight Communities as a project in its entirety, and the garden being an important aspect. Education services, Burnbrae Nursery and Cleves Primary, have been fantastic. Even from little things, well, firstly, they allow us to keep the garden open, and members of the public are allowed to access the garden. They also helped with things like leaflet drops in the school bags. The community payback team through Glasgow Community Safety Services. This was a garden that was developed within a primary and nursery school grounds, and there was a lot of heavy digging and heavy work to create that garden. And the guys who were on doing community service helped to create this garden. I believe, from what I've heard, that they were delighted to do so because it was so much more satisfying than picking up litter, and we're delighted to come and help the children of the local area. Cordia, the janitor, couldn't do without the janitor. The janitor opens up the gardens in the morning and closes the gardens for us, has helped build a bench, and has generally been really, really helpful. Glasgow Housing Association have given Chris, the horticulturist, office space because school just didn't have the facilities to give her an office space. Third sector organisations, as I said, like Pollock Carers, Deafblind Scotland, have been helpful, and the local community in spreading the word about the garden, and knocking doors and encouraging people to come along to our local community meetings. We had an AGM there in September. The steering group meet on a monthly basis, but we also have had several big-scale community consultations about the garden. And Police Scotland, again, thanks to them, community police officers. This is an area, as I said, that has a history of crime. And we have sadly had an instance where a hut was burnt down, and thanks to Police Scotland there's been more vigilance to make sure something like that doesn't happen. But also thanks to the local community, because the neighbours across the road are involved in the garden, and they look out, and I have to say that, for that area, the amount of vandalism, just one incident has been impressive. In what ways is this an assets-based approach? Well, it didn't start off asset-based, I have to say. It started quite top-down. It was funding from the Scottish Government that led us to develop healthy weight communities. But the garden has always been an assets-based approach as part of this overall programme of work. Very much community-led and very much a long-term approach to build sustainability. And that's through community ownership. As I said, the garden has its own committee and steering group, but also the local school have taken ownership. They don't see this as a separate entity. It's part of their school and their grounds, and I know they're very proud of it. This garden values the use of existing resources, local people's time and skills. Whilst there's not a lot of people in the area who had gardening skills, there were several people who stepped forward to help and support community members and to give their time up. It was also local members' knowledge of the area was invaluable. When we were going around and we hired like a minivan and we went round the whole area looking for suitable green spaces, they were able to say, oh no, we don't want to go there, too much territorialism going on. No, maybe you don't want to go there because there's it was old mining, you might have problems developing a garden there. We've also used existing hard resources, and that's in the sense of recycled materials have been used for play features. Confidence building and empowering through learning and opportunities has been located within a school, has made that easier without a doubt. Enhanced relationships and mutually supportive community networks developed through the opportunity to create together in a shared community green space. What that means in real terms is that people have got a place that they can go and hang out that's safe and quiet for them. I've met people with it at the garden, and they've said that they've met neighbours that have been there 20 years and they didn't even know that this person lived round the corner from them. Therefore, it builds a resilient community, providing a bridging capital. It's linking people with different outlooks and values to support them, each other, to get on and adapt to the changed circumstances and crisis. We have quite a number of people in the garden who are unemployed and have mental health difficulties. The garden has enhanced partnership working coordination within the local area. You saw the list of partners there working together. And the garden very much has a volunteering ethos and opportunities created to grow and learn together. This is a picture of the garden before. So this is the school grounds, and that's the houses I was telling you about. There's one lady in particular who has been very involved in the garden, and this is it after. This is what we've created. Now this only shows the actual gardening development, the plots and the polytunnel and the tool shed, etc. And you can just see a little bit of the play features over there, which is a den, but it doesn't really show all the play features. This is, we had a fantastic summer, and this is a picture of the local children from the school who were obviously harvesting the potatoes, and the lady I was saying, Alison, who lives across the road, that's her doing her watering, and I think that's a picture of her with the produce as well. The garden has a website and a Facebook page and posts regular updates on Twitter, and if you're interested, that is the website address. And that's my contact details if anybody's interested. I'd like to finish with just a few quotes from people about the garden and what it meant. We're in the process of an evaluation on the garden from the Public Health Resource Unit, who will obviously look at its outcomes from an asset-based approach. But some of the quotes from the community garden users, I think, are as strong and as powerful as anything about why you want to do assets-based work. These are from some of the plot holders. I'm more active in meeting new people. It takes me out of the house to spend more time outdoors. It gives me respite from my carer's role. This will help me with eating healthily and save money. And from a couple of comments from some of the children of the local nursery, I like showing my mum the strawberries. I like the mud kitchen. I make chocolate cakes. And I think that's what it's all about. And that's what we're here to do today, is to try and make people's lives better.
Fantastic.